Today, 30 million households are providing care for an adult over the age of 50, and that number is expected to double over the next 25 years. As the nation grows older, the need for caregiving will be as common as the need for childcare. And today we're here with geriatric specialist Dr. Amy Sanborn and registered nurse Julie Hill to discuss the reality of caring for an aging parent and how Spectrum Health can help. Welcome, ladies.
Thank you.
And so there are a lot of people who may be watching, or people that we know, maybe 40, 50, 60 years old, and they're caring for an aging parent or relative. It's called the sandwich generation. What exactly does that mean?
So the sandwich generation refers to people who still have care that they need to provide for a child, and then are now adding on care needs that their elder parent or loved one need, while continuing to deal with the stress of life, job, retirement, their own potential health. It's estimated about in the next 10 years, about 2/3 of baby boomers are going to be in this generation providing care for an elder. This can provide a lot of additional anxiety, stress, worries, feelings that you're not meeting anybody's needs, and that everything is just falling apart and there's not much you can do.
Yeah, it can be difficult. You can feel like your plate is overflowing.
Absolutely.
And so what can we do to kind of help manage some of that additional stress?
Great question. So the stress is going to be there. This is a new life journey that you're on. It's not a quick fix. It's not one thing that, well, there's one fix and then we're moving on and we're back to normal. This is the new normal. So realizing that it's not all on your shoulders, that there are other people in the community that can provide support for you, and asking for that help. Coming up with a plan that includes yourself, your sanity, your needs, the dignity and wishes of the elder that you're caring for, making sure to also include your spouse that are important, making sure their needs are met, and remembering that they're your life partner and they can help you along on that journey and support you. And of course, making sure that your kids are taken care of.
Sure. There's something called Spectrum Health at Home, and it can really assist in caring for an aging parent or relative. Julie, can you tell us a little bit more about Spectrum Health at Home?
Yeah, Spectrum Health at Home actually comprises several different agencies and opportunities, but basically it's a desire to provide the services that patients need and provide them where they're most comfortable in their home. So the services have a wide spectrum of availability and focus, and our goal is just to really bring what's needed to the home.
Yeah, and that can be in a lot of different ways, even in ways that you felt there was not any source of help.
Yeah.
It can be a little unexpected.
It can. There's things that folks haven't thought of, like balance evaluations, home safety inspections, medication assist. There's private duty options like home care, respite care, taking transportation to appointments, many options that are available just at the call.
Yeah, and visiting nurses and private duty. That's something else too that we should talk about.
Yes, visiting nurses is actually a Medicare and insurance-based service, and provides intermittent care for things like, on the screen we're talking about those balance assessments, post-surgical, cancer services, cardiac rehab, wound care, and that is based through insurance payment plans. For short-term or long-term, depending on the patient need.
Yeah, there's a lot to talk about in this subject, and we are just scratching the surface right here, making people aware of what is available. Another way to do that is by attending a doctor dialogue that's happening November 29th at Calvin College, and both of you will be a part of that.
Yes.
What exactly will happen at that doctor dialogue?
We are planning to have short presentations and give some more information about ways that Spectrum Health can assist the sandwich generation and the people who are needing our services. But also, we will be having a panel discussion and taking questions, and we will have community representatives available as well to answer some questions and provide information on their services.
Yeah, and as you can see on your screen, you do need to register by going to spectrumhealth.org. You can also submit questions, and I know, Dr. Amy, that is really important to kind of be able to have that interaction with people as they come, and some people really wanting and needing those answers to give solutions to their family.
Yes, absolutely. And we want to be able to provide the necessary resources. And a lot of times we get the same question from about 20 different people and so we know that that's really a need that we
Right.
need to address.
Yeah, because, you know, on this journey, you may feel like you're alone, but oftentimes when we come together like that, we realize that we're not.
Yes.
And we realize that there's additional help out there.
Absolutely.
Yeah.
Definitely.
Well, thank you both for coming in today and sharing this information with us. We appreciate it.
Thank you.
And we'll
Thanks.
put it online so you can know all those details. We'll be right back with more 8 West. Don't go away.
That's West.